assessment of the heart تقديم الأستاذ الدكتور حكيم شاكر حسن. الجزء الأول من الأسسمنت. طبعا الأسسمنت مالت الهارت يظل حتى نسوي كومبليت أسسمنت المفروض عندنا أسسمنت للثوراكس وأسسمنت للدومن. شباب انتوا أخذتوا الأسسمنت بالكورس الأول مالت الهارت ومالت الدومن ومالت الثوراكس. أما هذا الكورس فأنتوا مطالبين بالكومبليت أسسمنت أوف ذا هارت، يعني مطالبين بالهارت أسسمنت وبالدومن وبالثوراكس. شباب جبت لكم طبعا هسه جبت لكم أفلام، كل جزء جبت لكم أسسمنت على الهار، فيلم على الأسسمنت أوف ذا هارت، وفيلم على الأسسمنت أوف ذا ثوراكس، وأفلام على الأسسمنت أوف ذا الدومن. وشرحت لكم قبل كل فيلم شنو هي الشغلات الرئيسية اللي حتشوفون بيها، علقت لكم عليها. First film include the following: assessment posterior thorax, inspection للثوركس البوستيريور، يشوفون بالبيشن، يشوفون للثوركس posterior، يشوفون chest expansion posterior، يشوفون طبعا tactile fremitus، يشوفون percussion، يشوفون diaphragm excursion، يشوفون auscultation.
To assess the thorax, ask the patient to breathe normally as you observe his respirations. Respirations should be regular and symmetrical, and the accessory muscles should not be used. The patient should breathe comfortably while sitting with his arms at rest. Now move around slowly to the patient's back. As you do this, assess the anteroposterior and lateral diameters of the thorax. Normally, the lateral diameter is up to twice the anteroposterior diameter for a ratio of about 2 to 1. Still standing behind the patient, use your finger pads to palpate the spinous processes. They should be evenly spaced and non-tender. Next, assess respiratory expansion. To do this, place your thumbs at the level of T10, or the 10th thoracic vertebra. Spread your fingers, allowing for small folds of skin between your thumbs. Ask the patient to take deep, slow breaths. As he does, watch your thumbs move with respiration. Their movement should be symmetrical. Next, assess for tactile fremitus, or voice sounds palpated on the chest wall surface. Using the ball of your hand, feel for vibrations as the patient repeats the phrase 99. Move from the apices inside the scapula down to the lower and lateral 99. Thorax. In each location, 99. You should feel equal vibrations. 99. Now perform mediate percussion using a systematic pattern so you can compare the two sides. Resonance should be equal over the lungs. You should hear dullness over the diaphragm. Hyperresonance means you found an area of increased air in the lung or pleural space, as with a pneumothorax or acute asthma. Abnormal dullness indicates decreased air in the lungs, as with atelectasis or a buildup of pleural fluid. Now assess diaphragmatic excursion. To do this, ask the patient to exhale and then hold his breath. As he holds his breath, percuss from the scapula down to where the sound changes from resonance to dullness. Mark this spot with a pen. Now ask the patient to inhale deeply and hold his breath as you percuss further down to the new area of dullness. Mark this spot too. Repeat this process on the other side. Measure the distance between the set of marks on each side. Normally, this distance, which represents diaphragmatic excursion, measures 3 to 5 centimeters and is equal on both sides. Next, assess the kidneys using blunt or fist percussion over the costovertebral angle. Percussion in this area should not cause tenderness. Finally, auscultate breath sounds with the diaphragm of your stethoscope. To do this, instruct the patient to breathe deeply through his mouth. Starting at the lung apices, auscultate the lungs. Move systematically from side to side down the patient's back and laterally toward the axillae. Be sure to listen for at least one complete respiration at each location. Normal